Gentlemen, we have a hot conversation today. It's about the popular medication being used for weight loss and their impact. There's so much noise surrounding the topic. We wanted to invite someone who knows a lot about the facts about these drugs. Dr. Rocio Salas-Whalen is a double board certified endocrinologist and obesity specialist. That means she is legit. She is here in New York. The doctor is in the house to answer some of these questions you were watching backstage.
Yes.
What hit you from the 40-minute conversation we've had already?
The first guest, which
Tara,
I always want to say thank you to whoever participated in the studies, because thanks to them, we are where we are and we have these wonderful medications. But what stood out for me the most is that during the study, she was under control situation, right? She was under controlled supervision, frequent visits. And she did great. She had great success with minimal side effects. She even said it, I didn't have much side effects. And that has to do a lot with the supervision that you're gonna get while on these medications. That's gonna make the whole
But she was
difference.
under a medical trial, so that's the most supervised. Where are people supposed to go to get this supervision?
To a specialist, obesity board certified physicians, and if not, endocrinologists, because same as in the studies, we as physicians treating obesity, we see our patients every 8 to 10 weeks, right? We're always on communication for any side effects. So this is a drug that needs to be supervised. That's the #1 thing, right?
Tell me, we had Aditi on and Jacob and Qatar. There's emotion. You know, I never want people to leave this show feeling shortchanged, that they didn't get their voice in. It's a complex conversation. As she brought up, food deserts, all of these things that contribute to obesity and how people are treated who are struggling.
So we know now, and actually since the WHO, since 1954, categorized obesity as a chronic disease. It's not until 2013, the American Medical Association accepted obesity as a chronic disease. So we're...
Why the delay?
I think there's a lot of bias, right? I think even as healthcare providers, when I went to medical school fellowship, it was all about eating less and exercising more, right? We still grew up with that, but things are much different. We know, we understand that obesity is a chronic disease, as type 2 diabetes, as hypertension, is multifactorial. And I feel like when we explain this to the patients, to the population, there's a huge relief of guilt, right? Because before we used to tell patients, it's all upon you, what you do or don't do. And that was it. That's the help that we were giving, right? But now we are aware, and me as an obesity physician, I've been humbled by all my patients with obesity, because that idea of a lazy couch potato person is not real. I've never met a patient with obesity that hasn't tried everything under the sun, and that is not trying. They exercise, they're doing their work, they're doing what it's supposed to be doing, and the weight loss is not happening.